Do you want to make sure that you have passed the visa medical examination? Of course you do. In order to do that, you have to know what happens during this process, the tests, the procedures, and the questions included, and how to prepare physically and mentally in order not to waste this life-changing opportunity. I will also show you how much the test costs, as well as how much the vaccines cost. So stay tuned and make sure to watch this completely for your own sake. Disclaimer, what I will be sharing to you is based on my own actual experience done here in Singapore. But you will undergo the similar visa medical examination process in your own country. So listen and learn so you will be equipped for your upcoming medical examination. As well as I will be giving some comparison and tips on how the medical examination is done in the Philippines. Once you have received your official NVC interview letter or the US Embassy's appointment letter, you should now schedule an appointment with accredited clinics listed in their official website. Emphasis on the word accredited, as it would be useless even if it's done by the best doctor in the world. As long as he is not listed, he is not qualified. So make sure to base it from the US Embassy's website. I am currently living in Singapore. At the time of my visa medical examination, there was only one clinic affiliated with the US Embassy's process, which was the Fullerton Medical Group, located at Takeshimaya Tower near Orchard MRT. My agent told us we should book an appointment 1 to 2 weeks prior to the examination. So my US visa appointment was scheduled on the 16th of April. We were planning to book an appointment at least 2 weeks prior to the interview date or plus few more days if possible to get the maximum allowance date. Good thing I called Fullerton Medical Group earlier, which was on May 16, and asked to book an appointment. The earliest available appointment on that date was only on the April 2, exactly 2 weeks prior to the medical visa interview. So make sure to call and book an appointment as soon as you have the interview letter. The Fullerton clinic staff told me that they will email me a registration form for us to fill up. Then, email them back the filled up registration form together with the appointment letter and passport. They said that payment will be done over the counter once we come during the scheduled medical examination date, which was scheduled on April 2 at 10 a.m. for me and 10:15 for my wife. They accept cash, MasterCard, Visa, or Nets payment as well. They told us to bring the following. Number 1, visa appointment letter. Number 2, unexpired passports. Number 3, 2 pieces of 2 by 2 inches photo under the US Embassy's guidelines. Number 4, copy of your immunization record. For the Philippines, the accredited clinic is St. Luke's Medical Center Extension Clinic, located at Ermita, Manila. No booking is required for the medical visa appointment. Just go 2 weeks prior, then it will be a first come first serve basis. So you should go early as there is a long queue or line. On the day of my medical examination, we arrived 30 minutes before the scheduled time, which was 9:30 in the morning. The clinic was packed as it was running as a regular clinic as well. A registration form in the clinic is different from the rest of the patients. So just politely ask the medical staff for it and tell them that you are going for the US medical visa examination. After that, you will be asked to take a seat and wait for your name to be called. I waited for 30 minutes before my name was called for. Time check, 10 in the morning. Once called, they will check all of the required documents like number 1, appointment letter. Number 2, unexpired passports. Number 3, 2 pieces of 2 by 2 inches photo under the US Embassy's guideline. Number 4, to fill up another registration form. FYI, this must contain the US address, so make sure you know the address of the hospital you're going to. After the registration process, she will ask you to submit a urine sample as part of the examination. Tip: you don't have to force yourself to pee or drink too much water just to have that voiding urge. Take your time, as it will take hours for you to finish the whole process. You can submit the urine sample when you are about to leave the clinic. It wouldn't matter. Luckily, I had the urge, so I was able to give them the urine sample immediately. The urine sample is for the urine PCR, which measures the levels of protein and creatinine ratio. They also gave me a yellow immunization record / pamphlet. It is called International Certificate of Vaccination and Prophylaxis, with some of your details pasted on it. The authorized nurse who will inject the vaccines will have to sign on that yellow record, so make sure that it was done properly after the vaccination. After a few minutes, I was called forward by the authorized physician for the medical and physical checkup. Here, they will ask you for your medical history, medications you are taking, rundown of certain diseases, including infectious diseases like sexual transmitted diseases, tuberculosis, hepatitis, chickenpox, and etc. They will also ask you for any drug or food allergies. They will ask you about your immunization history, hospitalizations, operation histories. They will ask all of these things to have a better picture of your general health status. For the immunization history, I brought a proof that I completed the hepatitis B vaccine and have developed an antibody for it. I also mentioned that I had shingles before, but I don't recall having chickenpox. Neither does my parents. So for this, the doctor decided to include a test to confirm if I still needed a chickenpox vaccination. Tip: the confirmation test will be cheaper than the actual vaccines, so make sure to keep or secure all the immunization records you have. I will show you a billing comparison later. Tip number 2, make sure you sound pretty convincing that you actually had the disease, so the doctor won't have to check the test or give you the vaccination anymore. But please don't lie. Please refer to this table to check what type of vaccines are required according to the applicant's age. Most of us will fall under this category. You can check the required vaccinations for your dependents based on their age using this table as well. Next is the physical assessment. She began this procedure with a cephalocaudal assessment, meaning from head to toe assessment. She started with my eyes, checking for corneal reflex, checked for the pinkishness of the sclera, and tried to check any yellowish discoloration or jaundice. Then she checked my mouth, asked about any dental history or issues, like tooth decays, tooth extractions, root canal, and etc. She checked my lymph nodes as well over my lower jaw and neck area. Then she moved to auscultating my heart and counted my heart rate via her stethoscope as well as a finger counting. Next, she auscultated my lungs via the backside as to breathe in and out. All of these were done while I was sitting down on a chair. After which, she asked me to lie down on a small high bed to check for my abdomen. She palpated it, then auscultated it. I was expecting a digital rectal examination to check for the prostate or hemorrhoids, but she never did. Even for my colleague who did his medicals in the Philippines, they did not do so as well. She just asked me for any history of it. That's it for the physical assessment done by the accredited practitioner for me. You should be at your best health or look like you're healthy for the visa examination. So 2 weeks prior, you should not engage yourself in activities that could lower your immune system or activities that are too tiring or too stressful. And of course, stay away from sick people if you can. Wear a mask if you have to, especially during the flu season, and drink some vitamins just to have some additional protections. But just in case you get a flu during that day, don't worry. I also had a sinus symptoms of flu, but I still passed during my medical examination. I was scared and worried though. Worried about being positive for TB, as my cough was still active on the 8th day. I was expecting to submit a sputum sample, but she told me they don't require sputum samples anymore to screen for the tuberculosis. They prefer to do the x-ray first. And no more intradermal tuberculin testing or the Mantoux test. Thank God, as it looks very painful. Next, I was called for the blood testing for the screening and the titer. They directed me to this small, comfortable, cute cubicle with a great seat with a curtain cover. So of course, selfie was done during the waiting period as I waited for around 10 to 20 minutes. That's the picture. What are the blood tests taken for? Number 1, VDRL, a blood test taken for syphilis. Number 2, chlamydia. And number 3, gonorrhea. So all of these three are sexually transmitted diseases. So tip, the practice of abstinence is needed in this category. So better live a faithful and monogamous lifestyle prior to examination. Meaning, no one-night stands with strangers, no unprotected sexual activities with your newfound partner or partners, no hookers, no strippers, and all of those stuff that falls under that category. You know what I mean. You can resume it after the examination. Afterwards, I was directed to have my chest x-ray done. You need to take out your shirt for this procedure. I was scared because this is the part where I should be worried, knowing that I was having flu-like symptoms for the past 8 days. The next, they check for my height and weight and the BMI. Don't worry about the BMI. I know some applicants who exceeded the normal weight limit but still passed their medical examination, so no crash course diet is needed prior to this test. Then next is the vision testing, which is quite different from what we normally experience during the regular medical examinations. They won't ask you to read a Snellen chart across the room. Here, you will look right through a machine that looks like a binoculars or microscope. The machine is called Thymus Vision Screener. It involves series of different visual tests, including number 1, Snellen chart, number 2, a blind color test, number 3, direction testing. For the direction testing, you will be asked which way the W is facing multiple times in different levels. The medical technician will control the machine and will give you instructions for the test as it goes on. Tip: make sure to put your eyes really close to the lenses, as it makes a lot of difference in terms of clarity. Then last but not the least, I had my vaccinations done. Normally, they will give you this set of vaccines as these were given to my wife. Number 1, Boostrix vaccines, which includes diphtheria, pertussis, tetanus toxoid. Number 2, Fluadri North Vaccine 54, or for short, flu vaccine. Number 3, Priorix vaccine, or the MMR vaccine. Number 4, Varilrix vaccine, or the chickenpox vaccination. But for me, it was given partially as a chickenpox, and the MMR vaccine will be decided once the test results comes out, which eventually came 4 days after, wherein I developed antibodies for the chickenpox, meaning I don't have to get injected with the chickenpox vaccine. I only needed the MMR vaccination, in which she could have given me on the same day. So take note of this for all of you. It will be less stressful or hassle if you do it in one day. After being injected, the nurse signs our yellow pamphlet immunization record. Intermission. If you find this video helpful, please click the subscribe button if you are not yet subscribed for more similar helpful videos. Next is the payment. This is the bill we have received for today's activities. Blood test, the VDRL, chlamydia, gonorrhea, urine PCR cost 135 Singapore dollars. For me, since I needed additional varicella titer test, it costs around $42. Next is the medical examinations. I think it includes the doctor's fee, eye screener machine, and all other processes. It costs around $150. Boostrix vaccine, or the DPT vaccine, or the diphtheria, pertussis, tetanus toxoid vaccine costs $75. Fluquadrix Nord vaccine, or flu vaccine for short, $35. And chest x-ray will be $35 as well. So the total for my first bill is $505 and 0.04 cents, including the 7% GST tax. Since I had to go back for the second vaccine, which is the Priorix vaccine or the MMR vaccine, it cost me $80.25. So my grand total bill will be $585.29, tax included, which is equivalent to 22,241 and 0.2 pesos. If you do not need to have your chickenpox titer check and just have the vaccines, like for my wife, the total will be $652.70, or equivalent to 24,802 and 6 cents pesos. I believe this is the regular price in Singapore.
In the Philippines, the basic cost will be 17,025 pesos. So, Singapore is more expensive by 7,777.6 pesos. So clearly, it is more fun in the Philippines, and Singapore remains to be a fine city. So if you are at a tight budget and is still deciding which country to have the visa interview, which includes the medical examination fees, I suggest you choose Philippines, especially if you have multiple dependents with you. After the test and vaccines, they gave me a CD for the X-ray results. They said that the results will be forwarded directly to the US Embassy. Unlike in the Philippines, the medical examination results will be given to you, sealed in an envelope, which you must not open, and must be given to the consulate during your interview date. I arrived at 9:30 in the morning and left the clinic at 1 p.m. So total of 3 hours and 30 minutes. Most of the time wasted was waiting for your turn for the different steps of the process. I will be making a tutorial video on all the steps and procedures I needed to reach here in the United States. So please click the subscribe button and notification button to keep you posted. I am sure you will need the hands-on experience in order for you to be more prepared. You can also watch my US interview visa experience, which I created in the most detailed way as possible, since that's the next step after the medical examinations. I'm sure you will learn some tips and tricks for your upcoming visa interview to make sure you're gonna pass it. Hope I have cleared some questions or queries regarding the medical examinations for the US visa interview requirement. Me and my wife are wishing you good luck with your medical examination and hope it goes well and see you here in the United States. Thank you and God bless.